everybody enjoy their coffee or water, and then Dr. Rapaport will continue her lecture.
Thank you. We're going to go ahead and just go back for a quick second and talk about symptoms, because there's some symptoms that are a little bit more pathognomonic for a mold and water damage building induced illness. Static electricity in the wintertime, when you see high static electricity, red eyes, blurred vision, certainly cough and shortness of breath, frequent urination, and a lot of thirst. And we'll go into more details later about that. Cramping, and so if you have someone who says, when I get in bed, my feet cramp up, my feet become like claws, or my hand cramps, that can be very much associated with this illness. And here's the excessive thirst, but also a lot of pain. And then on the next page, the ones that worry us the most here, memory problems. And there's really a specific kind of memory issue, problems finding words, and as we'll talk about later, that reflects some caudate nucleus atrophy. Executive function problems, anxiety, panic, mood problems, all of these neurological symptoms. Those are all symptoms that you want to be thinking about, or if you see them, maybe think about water damage building. So in your practice, if you're trying to determine if someone has the possibility of some of their illness symptoms are due to their exposure to water damaged buildings, some of the things that you can look at include simple tests and then more complex tests. The first test is visual contrast sensitivity, and it's a measure of the direct neurological impact of cytokines. Visual contrast sensitivity is looking at spatial frequency, and when people have problems with this test, they may have problems with night vision, light sensitivity, blurred vision, and this is what the test looks like. You'll see lines of black and white going to one side, straight up and down, the other side, and horizontally. And there are columns, there are 5 columns, and they become progressively more difficult to look at. And I've seen patients doing this and this. You have to have the right amount of light to read it. If you do this in a dim room, most people may fail. So you have to have a good amount of ambient light when you're doing this test. There are 2 ways of doing it. There's a handheld device that you put up to your chin so that the sheet with this bar graph is a correct distance. And then the other version is one that you can do online. There is one online called Free VCS. I don't think it's necessarily the best test. There's also one that is available at survivingmold.com. Some of the tests that you can look at to determine whether or not there's some immune dysregulation that have been most associated with mold exposure include looking at MMP9, transforming growth factor beta 1, C4A, look at the impaired somatobiome with something called Marcons, which we'll talk about, and VEGF. Vascular endothelial growth factor, when levels are low, causes poor oxygenation to tissues, and that's a really good indicator of the muscle cramps. This type of biotoxin illness can cause a lot of hormonal effects, and particularly neuroendocrine effects. And this is just a summary of some of the problems that can occur with the hypothalamus. The pro-opiomelanocortin cells in the hypothalamus produce this long molecule called pro-opiomelanocortin, and from that we break it down into various components. So here you have alpha melanocyte stimulating hormone, here you have beta endorphin, ACTH is here, and so we make a lot of hormones, use them, and then break them down in various components. And one of the hallmarks of this illness is low melanocyte stimulating hormone, or low MSH. Approximately 95% or more of patients with biotoxin-induced illness due to water-damaged buildings will have low MSH. In the US, this test is run through a company called LabCorp. They used to have a reference range of 35 to 81, and then they changed it overnight to be 0 to 40. About that time, the company that owned LabCorp was involved in litigation over, owned another company, insurance company was involved in litigation for a home that had been water damaged, and they just changed the values overnight. So we try to stay with the normal range rather than the sick range. Because beta endorphins are produced from the same molecule, when you have low MSH production, you also tend to have low beta endorphin production, so you're more susceptible to pain. MSH is critical for immune function, particularly in your boundaries, and it's a regulatory hormone for a lot of the other brain-based hormones. Antidiuretic hormone is the hormone that keeps you hydrated. If you drink a glass of water, your kidneys want to get rid of that glass of water. Antidiuretic hormone keeps that fluid in to keep you hydrated. And so when we look at antidiuretic hormone, also known as arginine vasopressin or vasopressin, we want to look at that in conjunction with how concentrated the blood is. You can't do an ADH 1 week and the osmolality the next week. They have to be done simultaneously. And what we see are patterns of dysregulation. You may have ADH in a fairly good range, but if your osmolality is too high, if your serum is too concentrated, that ADH is too low for that osmolality. So we're looking at patterns rather than specific numbers. This can cause thirst, frequent urination, and because your sweat is more concentrated, has more electrolytes in it, you're going to also have more static electricity in the wintertime. Adrenocorticotropin hormone and cortisol also is dysregulated. Again, it's not just measuring cortisol. You want to look at these at the same time. Now, if someone has a morning cortisol of, in our measures, we would say maybe 5, we know that's low. But if they have a cortisol of 7 and their ACTH is 7, which is too low, you know that they're not responding appropriately. So we're looking again at how these interact together. Sexual hormones are affected. We tend to see an elevation in aromatase expression, and so testosterone gets converted into estradiol, and we see a lot of estrogen dominance, low progesterone. In men, we see low testosterone. And again, you have to look at the person in front of you. If you have a 25-year-old man, he has a testosterone level, and again, I don't know how these compare, but in the US, a level of 300, that's too low for a 25-year-old. If he's 95 and he has a level of 400, that's probably pretty good. The last thing that we can look at from a neurological perspective is something known as a neuroquant. This is what Paul was referencing when he was talking about volumetric analysis on MRI. This is a 3-dimensional MRI that the images of the 3D MRI are submitted to a company in the US. We send them to a company called Cortex Labs, and they apply a computer program that measures the volume and the percentage of the total brain volume of different regions of the brain. And we tend to see a very characteristic picture: caudate atrophy, hypertrophy of the forebrain, cortical gray matter, that seems to indicate a water damage building exposure. And some of the symptoms really follow that pathology. The really good thing about doing the neuroquant analysis is that we see those changes reverse with treatment. So when people say, oh, I have caudate atrophy, I'm doomed, the answer is no, you're not doomed. We can reverse that. And it's really lovely to see. So now we're going to take that systems biology approach and apply it to how one approaches a patient with water damage building exposure. Remember, we're going to look at the genetics, the external triggers, the somatobiome, the danger responses. So when we look at genetics, if you look at the world of mold illness, you're going to see the name Richie Shoemaker, and he developed a schematic of something called HLA susceptibility. HLA stands for human leukocyte antigen. It is a gene. You have one from your mother and one from your father. I'll go into that in just a little bit. Transcriptomics, again, looking at what genes are being expressed, the RNA, and we see some unique changes. We see suppression of mitochondrial ribosomal effects, sarsen-ricin loop effects, and again, with treatment, we tend to see those. The early research is showing that those transcriptomic changes can improve. Risk factors, genetic risk factors. If you have loose connective tissue, someone with Ehlers-Danlos or hypermobility in their joints, they're going to be more likely to be susceptible to water damage building effects. Can't give you the reasons why because I don't know, but we tend to see a lot more effects in people who have loose connective tissue. And certainly if you have problems with detoxification, and as I think we all agree, if you're sick, you have problems with detoxification. But there are some genetic risk factors. So going back to the HLA, we're looking at the major histocompatibility complex 2. So you're looking at DRB and DRQ. We inherit one gene from our mothers and one from our fathers, and these genes express proteins that are found on the cell surface. Their job is to convert a cell into an antigen-presenting cell. They capture the proteins. It's been described as a bun where an antigen will fit into the bun, and that cell presents it to the acquired immune system. Dr. Shoemaker's schema, what he did is he looked at thousands of his patients, and he compared them, of the patients who were sick from water-damaged buildings, and he compared them to other patients in his primary care practice when he first was doing mostly primary care, general family medicine. And he came up with this schematic and saying that these are HLA types that make people susceptible to lots of things. The next are the types that make people susceptible to mold. The next are the types that make people susceptible to borreliosis. The next, if you have a 1-5, you're more likely to have low MSH. And then the last two are people who are susceptible to ciguatoxin and dinoflagellates, Pfiesteria, things like that. But I don't think it's that simple. Dr. Shoemaker quotes 24% of his patient population has one of the susceptible types. In my practice of looking at patients who are sick from mold, 100% have at least one of these HLA types. And I started kind of wondering, I couldn't believe that 100%. And so when you start looking at HLA allele frequencies, you look at the databases, they're by country, they're by ethnic background, racial background, you realize that the frequency of these alleles is actually much higher than what Dr. Shoemaker reported. There's a HLA allele frequency database, and I just looked up Belgium, and 90% of the total alleles identified as susceptible, more than 90% of people in Belgium have at least one. So it's a very expensive test. You'll see it in the literature. Do this test, and that way you can tell your patients if they're susceptible. I think it's probably a waste of money. In order for a cell to become an antigen-presenting cell, it needs the major histocompatibility complex on it, but it also needs other proteins. It needs a B7 protein, and then the immune cell that it docks with needs a CD28 or CD152, and those are stimulatory or inhibitory. So you need two keys to turn on antigen presentation. But to me, the biggest problem is less with what type you have and more, do you have them? Do you have these proteins on your cell surface? And we know that certain viruses like CMV and HHV6 will suppress gene expression. So it doesn't matter whether you have a multisusceptible or a low MSH or you have a non-susceptible type. If you've had CMV, HHV6, or even trauma, and I'll talk to you a little bit about the study on the trauma. If you don't have these proteins on your cell surface, you cannot present the antigens to your immune system as effectively. There was a brilliant study done in trauma where they took patients who were coming into a trauma center and they measured the amount of the major histocompatibility complex proteins on the cell surfaces. And then they measured them again 2 weeks later. What they found is by the time people got to the ER, enormously suppressed MHC. So they just didn't have these proteins on their cell surface, which makes sense. If you've been cut open with a trauma, you don't want to be reacting to everything that your body is seeing. You will die of that overreactivity. 2 weeks later, most people had recovered. Their cells, their immune cells, their antigen-presenting cells were making these proteins again, but a subset had not. And of the subset that had not, those were the patients who developed post-traumatic infections. So it really makes sense the body is up and down regulating HLA expression based on the circumstances. So what do we do to treat? Well, you want to support detox pathways, you want to improve HLA expression. If there's an underlying viral infection that has been activated, you want to try to treat that so that you do start to express more of the HLA proteins. You want to treat and prevent traumas, going back to those early childhood events, traumatic events. If you had an adverse childhood trauma, emotional trauma, abuse, that may carry forward with suppression of your HLA genes and suppression of these major histocompatibility complex proteins. And so you want to try to address those to try to recover. Vasoactive intestinal peptide helps with some of the transcriptomic changes that I mentioned. Now you also want to, moving forward to the triggers, well, we want to remove the triggers, right? That's what's inducing that danger response. So when it comes to eradicating the exposure, your best bet is to leave. Just simply leave where you are. Now, most people can't do that. It's expensive, and then how do you know that the building you're moving to is also safe? So you want to be able to test. If building smells musty, smells moldy, then it probably has mold. Our noses, our olfactory bulb is very, very sensitive to finding these volatile organic compounds made by mold and letting us know. When are you sick? If you're always sick at work and you're great on vacation, then maybe your workplace has mold in it. Cars can have mold. They certainly can have water damage. Having had one like that, I can tell you that after 10 minutes of driving, I would start sneezing and coughing. Got rid of the car, that just went away. Buildings with flat roofs, buildings that are not continually inhabited, also are at greater risk. And you want to try to find a safe place. That may mean within your home. So if you have a home that has water damage and you know the water damage is in your bedroom from the roof leak, maybe it's safer to close off the bedroom, to close off the vents going, the heating system going to the bedroom while that room is being remediated, and go sleep in another bedroom. I had a patient who insisted on staying in his home while it was being remediated, and he had a cough that just was never going away. And they reached a point in the remediation where he had to leave the house. He couldn't stay there any longer for about 2 weeks. The second day in the hotel, the cough went away completely. It's a really dramatic representation for me of just how important it is to avoid these inflammagens. You can try to purify the air. There are good quality air purifiers that will grab these inflammagens from the air. But remember, they're very, very small, and they have a Brownian motion. So just because you have an air purifier here, it doesn't mean that up here the air is going to be clean. There are people who will use ozone-generating kinds of devices. You want to be careful because the respiratory risks of ozone. But there are some other air cleaners that produce very, very low levels. You just want to be really careful of ozone. And then you want to check the humidity. If you have high humidity, you are at greater risk of having mold development. Little humidistats cost about $10 in the US. You can buy them at home improvement stores. You can buy them on Amazon. They're battery operated. You can keep it in your pocket and then go someplace and set it out, wait a couple of minutes, and it will tell you the temperature and the humidity. We want to remediate. If you're in a place that you can't leave, you want to try to fix it. You want to clean it. The way that I tend to like to test is through a system looking at qualitative PCR. A lot of places in the US will do something called spore trap method. They have a device that sucks air into it and it blows it onto a microscope slide at a rate of 15 meters squared per minute, and you do it for 5 minutes. You get 75 meters squared on the slide, and then they look at it under the microscope. The problem is that Aspergillus looks like penicillium under the microscope, and they don't tell you is it toxic or non-toxic Aspergillus. There are Aspergillus species that will not cause problems. The advantage of doing the qualitative PCR testing is it tells you precisely the kind of mold that is growing. And if you remember that Fab5, that's the test that is, those are the molds that are tested with what's called the Hertzme test. And because they represent different moisture contents, it's a pretty good test of determining is this a safe place, and it's relatively less expensive. So you want to find the sources of the moisture, remediate, retest after remediation. You want to remove your contaminated items. This was the most painful part of my personal remediation in my home. I love books, and I had thousands of books, and I no longer do, and I've let them go. It's a very, very difficult thing. The countless nights that I went back with a mask and gloves and goggles to my home to find my items and to go through my children's paintings from when they were little, and do I really want to keep this or not? It's a very difficult process, and it's part of treatment of your patients that I think most people ignore, is the grieving and loss that occurs with this. We want to bind the biotoxins that are within the body, and there are a couple of ways of doing that. You can use prescriptions, and we use cholestyramine, and we use cholestyramine, which is trademarked as Welchol, and I'll discuss those two in a minute. There's some over-the-counter options if you cannot get the prescription binders: activated charcoal, diatomaceous earth, bentonite clay. I reviewed an article recently on zeolite, so I'm not so sure if that's something I would quite recommend as much, whether or not it really captures these biotoxins that are in the system. But activated charcoal and diatomaceous earth certainly can. And if you have a patient who's very sensitive, you start with the over-the-counters. They won't be able to tolerate the others very well. So what are we doing? Well, we're trying to access the enterohepatic circulation. We start with biotoxins in the bloodstream, goes to the liver, it's excreted in the bile, goes into the GI tract, and because of these inflammagens are so small, they get reabsorbed back into circulation, and so you just aren't getting them out. Binders are simply acting like sponges in the GI tract, holding on to those biotoxins, and so you eliminate them. Welchol are tablets. The dose is 2 tablets per dose, and you take it 3 times a day. It's in the US, it can be very expensive if insurance doesn't cover it, and it's about a quarter as effective as cholestyramine. Cholestyramine is a powder. You mix it with water. You can mix it with juice. There is in the US, a regular pharmacy. Cholestyramine, Questran is one brand. There are multiple brands. They either will have sugar or aspartame, and they have dyes. So if you have a patient who just can't afford anything else and has to go with it, be aware that each dose has about 2/3 of a teaspoon of sugar in it. There's also a pure cholestyramine, which compounding pharmacies can get. It can be formulated with methylcellulose and stevia or by itself. If you mix it with methylcellulose and stevia and then mix it with a little bit of apple juice and let it sit for a little while, it'll thicken up. it's a pretty uncomfortable, or I don't want to say uncomfortable, it's not a very pleasant experience swallowing cholestyramine because it's adsorbing moisture, so you feel it as it goes down your throat. But if you let it sit with water or juice and thicken up, that seems to be better tolerated. You can mix it with ice, you can mix it with whatever you want. But the other problem with this is that it has to be taken away from food. And so timing of when you're taking cholestyramine, when you're taking your supplements, when you're eating food and your medications can be a little bit of a challenge. The biggest problem is with certain medications such as thyroid replacement. You really want to take it away from that. When you're taking the binders, you want to try to raise PPAR gamma as much as possible to reduce the risk of an intensification. And in order to do that, we recommend a 10-day no amylose or low amylopectin diet. That means no grains, no root vegetables, no bananas, no corn, really more paleo. And you want to do high-dose fish oil, the range of around 3,600 milligrams of EPA and DHA combined. A lot of the detail of this is in the very back of my presentation. There's a summary of stepwise of how to do all of this. Cholestyramine and Welchol can both cause constipation, and if you have a patient who already has constipation, that can also be a problem, so you use whatever you have. I tend to really like Iberogast. It tends to work well. Magnesium works well. Prunes work great, so whatever works for your patient. If you've done that visual contrast sensitivity test, the visual test, and it's positive, then you want to stay on treatment until the test is negative before you do any more blood testing again. If, however, your initial test, visual contrast sensitivity test is negative, you just got to pick a time. I usually wait 2 to 3 months. Moving on to the somatobiome in water-damaged buildings, we've got a couple of problems. The big problem for a lot of people is a type of staph epidermidis that likes to reside in the deep nasal cavity, and they become resistant to multiple antibiotics. So we call it MARCONS, multiply antibiotic resistant coagulase negative staph. It is different than Staph aureus, and in fact, in the agar dish, Staph aureus will not grow with MARCONS. So it's actually beneficial to have Staph aureus. Staph aureus likes the lower nasal cavity. MARCONS likes the upper nasal cavity. Certainly you want to address Borrelia viruses, activation, Candida. Dr. Boriscano mentioned Protomyxoa rheumatica, and that was identified by Steve Fry of Fry Labs. They were initially called FL1953 for the lab name. And then when they looked at it more closely, they determined that it was a new organism, so he named it Protomyxoa rheumatica. Well, we haven't heard much about it in the last few years because Protomyxoa rheumatica actually was not a new organism. It's actually a fungus called Pheniliformis massiae, and it's a big biofilm producer. It likes the blood vessels, so you produce biofilm up and down your blood vessels, decreases tissue absorption of nutrients, of oxygen. Testing can be very expensive through Fry Labs. It's around $1,800 to test this, and I can usually guess it's my sickest patients. It tends to reduce CD57 counts pretty low as well. So Pheniliformis massiae is another feature that you need to watch out for in the somatobiome. MARCONS, this is my guess. I don't know if this is true, but it's the way I like to think about it. So bacteria live in buildings. It's not just fungi and other things. And Staph epidermis lives in buildings. And when molds make toxins that affect mammals, we call them mycotoxins. But when molds make toxins that affect bacteria, we call them antibiotics. Think about penicillin came from bread mold. And so it's not surprising that this organism has developed resistance to different antibiotics if it's thriving in a water-damaged building. It's a guess. I don't know if it's true, but that's my theory, and it's how I associate it with water damage buildings. We do tend to see low MSH levels in patients who have MARCoNS. Treatment for MARCoNS is a combination of different things. Because it's in biofilm, you first have to break down the biofilm. So EDTA in a nasal spray is going to be an important piece. We were using Bactroban and gentamicin. The problem with gentamicin, even though it's not theoretically absorbed through the GI tract, some of it will drain down the back of the throat. In anyone who has hearing loss, you do not want to use that. You want to use vancomycin or clindamycin instead. But now we're starting to use colloidal silver and EDTA, and it seems to be doing a really good job. Colloidal silver does not induce antibiotic resistance, which is really nice. There's an additive, a mucoadhesive polymer that you can add to the nasal spray to allow it to adhere to the nasal cavity. If you've ever used beg spray, it shoots up and then it drips right out. And so the Mucilox helps it stay in the nasal cavity longer. And then there's some research really coming from patients where, just as with the gut microbiome, the rhinobiome also needs bacteria. And so patients are starting to snort kimchi juice. And Lactobacillus sakei is the organism that ferments kimchi, and it seems to be really good. Now, be careful with the kimchi you snort. It has to have this organism from South Korea. There are some others that don't work quite as well, but there's some good, if you search this online, you'll be able to find a nice at-home remedy for helping sinus infections and helping with MARCoNS. And then because MARCoNS grows when people don't have good, healthy immune systems, we really want to try to improve the immune system. I love transfer factor. It's probably my favorite type of supplement of all the things I use. I travel with it, and it really does help improve the immune system. You want to treat tick-borne diseases, you want to treat viral activation, you want to treat biofilm producers, and there's been plenty of discussion about that, so I won't go into any more detail. The next part of the danger response, a hypothalamic dysregulation, you want to look at all the various tests that you've done, the vasopressin, the ACTH and cortisol, sexual hormones, and address any problems that you may have found. And treatment, if you have low ADH and high osmolality, or even an osmolality of above 290 is probably too high. Some patients may benefit from using DDAVP, desmopressin. It's a synthetic arginine vasopressin. You want to be careful with patients who have hypermobility and enlarged cerebellum because it can cause severe headaches. So just be really cautious with those patients. Just going back this is in Dr. Shoemaker's schematic of how to treat water damage building illness. This is the very top of his pyramid. Vasoactive intestinal peptide is also peptide that we make and that you can measure. And if your levels are below 23, then you likely have a problem. You do not have to have low VIP levels in order to benefit from VIP. And VIP is one of the things that can help correct those the brain changes on MRI. In order to really be effective, you want to make sure you don't have MARCoNS, you want to make sure that the visual contrast sensitivity testing is normal, and that there's no ongoing exposure. And what I tend to do is I will give a patient a dose of VIP, and prior to the dose, I'll test TGF-beta1, which is an inflammatory marker, and then 15 minutes later, I'll test. And if TGF-beta1 doubles, it means they still have exposure. If it goes down, you know that it's a good treatment option. You want to address immune dysregulation. These are some of the symptoms that you can see from immune dysregulation. The clotting and bleeding problems, if you measure von Willebrand's factor, you might see too high or too low. People who get bloody noses when they're exposed to water damage buildings have an acquired von Willebrand's. The pathology listed here, and I want to really highlight his mast cells. And as I mentioned, one of the genetic changes we see is an upregulation of histamine receptors, downregulation of diamine oxidase, which breaks down histamine, and increase in histamine production. So not only are mast cells activated, but you're more sensitive to mast cells when you have this illness. And there are things that we can do to treat that. So along those lines, for cytokine production, Cyclical is a fantastic product to help reduce inflammation and cytokine production. It has curcumin, it has resveratrol, it has black tea extract, and it has tocotrienol. So it's a really great product that combines a lot of these things. The transfer factors, you want to avoid things that are causing an autoimmune response. So if you're eating wheat, you want to avoid wheat. And then for mast cells, quercetin works wonderfully to stabilize mast cells. And I've actually been using quite a bit of ketotifen, which I believe is available in Europe. In the US, it's only available as a compounding substance, but that works really well for some patients. The next area in which the system danger response occurs is in autonomic dysregulation. And you can see a whole slew of symptoms that occur. A lot of people will call this POTS. Anytime they hear autonomic dysfunction, they say, oh, that's POTS. But it's really much more subtle than that. POTS is only a small portion of it. You can see hypertension, you can see hypotension, you can see orthostatic hypotension, tachycardia, bradycardia, intestinal, the enteric nervous system. If you don't have a well-functioning enteric nervous system, you're not going to have the good motor complexes of the gut. You're going to have slow motility, and as we heard, increased risk for SIBO. Symptoms of a heightened fight or flight response, panic disorder, anxiety, OCD, obsessive compulsive disorder. Brain fog is huge, and it's also part of the autonomic dysfunction, and then fatigue. The sympathetic nervous system can get turned on from lots of different reasons. And so how do we treat it? Well, you want to try to reduce sympathetic overactivation. Meditative practices. If you have a patient for whom prayer is their meditative practice, tell them to pray. Whatever works for someone to help shift out of the fight or flight response works. Skenar, or if you all are familiar with the Skenar device from Russia, there are some wonderful protocols. The double collar induces a parasympathetic response. L-theanine is one of my favorite amino acids. It's largely found in green tea. There are chewable versions as well as capsules. It really helps calm things down. Essential oils, there's a company called Mio Energetics that does some brain-based essential oil blends. Dry brushing can be helpful. Again, we have our sympathetic nervous system, and our autonomic nervous system resides in our connective tissue, which is why we get so relaxed when we massage. You want to improve vagal tone. There's the Institute for Functional Medicine just had a conference on neuroplasticity, and if the vagal nerve is not healthy, you can try to improve it by stimulating the vagal nerve. And so deep gargling, I don't mean I mean really deeply gargling for 5 minutes at a time, 3 times a day, can help improve vagal tone. Gagging, you want to gag yourself with your toothbrush every day. The next area that the danger response can be a problem is the hypothalamic pituitary adrenal axis. As you know, adrenals make cortisol and adrenaline. Insomnia can be a big, big piece of this, especially because of this rise. If you see a patient who wakes up between 2 and 4 in the morning and they can't get back to sleep, they're having a bump in that cortisol response. The morning cortisol awakening response is coming a little bit too early. Phosphatidylserine does a nice job in keeping that low. So again, more meditative practices, laughing, exercise very gently, sleep is very important, and then diet, of course. These are some nutrients, and I won't go into this in detail because we've heard a lot about this already today and yesterday. I do echo Paul's caution with using cortisol, especially if you have already low ACTH, and I think that's one of the values of measuring ACTH if you can get it. If your ACTH level is low and you add steroids on top of that, you're going to drive it even lower, and it'll make that person have more of a challenge in recovering. The danger response at the mitochondrial level really has a lot to do with mitochondrial genetics and how mitochondria function. The mitochondria is the energy center of the cell. We take in glucose and oxygen, and we make ATP and make water and carbon dioxide. This is a schematic of the cristae, the inner cap membrane, and the 5 complexes that are used in energy electron transport in producing ATP. Mitochondria are really unique because they have their own genes. It's a misconception, though, to think that mitochondrial genes are the only genes that affect the mitochondria. There are 13 genes unique to the mitochondria, and there are 72 nuclear genes that affect mitochondria. So most mitochondrial disorders have to do with nuclear genetics rather than mitochondrial genetics. We inherit our mitochondria from our mothers. The ova has 100,000 mitochondria. The sperm only has 10, and it's located in the tail that gets jettisoned at conception. There are higher rates of mutation because mitochondrial DNA is single-stranded, and because that's where reactive oxygen species are produced, and so they're exposed to more DNA-damaging reactive oxygen species. When a cell divides, the mitochondria randomly segregate between the 2 daughter cells. So one daughter cell may have healthy mitochondria, and the other one may end up with mostly dysfunctional mitochondria. And that's something known as heteroplasmy. The threshold expression of mutation really talks about the severity of a mitochondrial mutation has to do with how many mutated mitochondria are within a cell, how much does that organ depend on oxidative phosphorylation. This is just a schematic talking about how stressors, physical as well as emotional, can end up with cell death, and particularly mitochondrial death, something known as mitophagy. It's a schematic on reactive oxygen species and mitochondria. TGF-beta1 is one of the markers we look at, and when it is elevated, it can cause further mitochondrial defects. One thing to know, complex 4 is of the energy electron transport chain, can be affected by TGF-beta1. Cholestyramine, if it's absorbed, if you have increased intestinal permeability and you absorb cholestyramine, it also affects complex 4 in a negative way. So you really want to make sure that gut is healthy if you're using cholestyramine. We talked about PAMPs and DAMPs. Mitochondria are the source of a lot of DAMPs, and ATP, if it's out in circulation, is considered a danger-associated molecular pattern, and your body will respond with inflammation. Mycotoxins also can stimulate mitochondria DAMPs through a process called NLRP3. It's an inflammasome. It's a NOD-like receptor, and it increases pro-inflammatory cytokines and reactive oxygen species. Trichothecene is one of the mycotoxins produced in Stachybotrys. So this is, when we say, okay, how do we treat mitochondria? I like to think of it in 2 different ways, functional and structural. This is the function of the mitochondria. We make ATP across this inner membrane called the cristae. You need magnesium, carnitine, coenzyme Q10, and D-ribose. So certainly any products that have those are going to be helpful. I use a lot of ribose cardio, and I use energy multiplex, which also has some adaptogens in it. In addition to the function, you also need a good structure, and this is what was mentioned earlier with lipid replacement therapy. And so here's sort of a summary. You can do each of these products individually, or you can do them in combination. Doing them in combination minimizes the number of pills that your patients have to swallow. And then clearly important, H2 absorb, we started using about a year ago in our practice, and noticing some really nice effects with it and helping to reduce inflammation because of the reactive oxygen species reduction. When it comes to clinical amplification, we talked about the immune system. And so thinking about the immune system, trying to stop that cyclical amplification, you want to improve your boundaries. You want to improve your immune system. You want to reduce background infections, and you want to manage stress. So all of those things that are listed here that feed are all entry points that you need to impact to stop that cyclical amplification. Several people talked about IgA. In the US, we have a product called Interrogam, which is secretory IgA. It will bind to LPS, it will not bind to food, and it's been helpful in some patients, the powder you mix with water if someone has low IgA levels. Cyclical amplification in the mitochondria. Again, you want to stop the dysautonomia, you want to improve mitochondrial function, and so there are lots of things that you can do here. Under the hypoxia that occur, hyperbaric may have a role here. Gentle exercise certainly does. If you're not hydrated, you're not going to get good oxygen to your tissues regardless. You want to treat anemia, consider supplemental oxygen. If you have sleep apnea, going back to our dentist friends, a good dental device that can help with sleep apnea may be helpful. And then the area that I've had probably been the most impressed with is addressing cyclical amplification when it comes to limbic system activation. There are two programs that I'm aware of that help retrain the limbic system. One is called Dynamic Neural Retraining System by Annie Hopper, and the other one is known as Amygdala Retraining by Ashok Gupta. Dr. Gupta is in London, Annie Hopper is in Canada, I believe, or Florida. She goes between the two places. These are each 6-month programs that your patient will do by themselves at home. They're approximately $300. They're both comparably priced, and they have a guarantee. If the patient is not better in 6 months, they get their money back. It's a series of techniques that they do to retrain their limbic system not to go into fight or flight. And the most dramatic improvement I've seen in my career was a patient who had been wheelchair-bound for 17 years. I'd been treating her for about 7 of those years. No energy, mast cell activation. I mean, she was on a slew of medications, a slew of supplements. Over the course of those 7 years, I'd gotten her about 30% better, but she was still dependent on supplements. I told her about this when I learned about it. She went home, and she's very stubborn, and she does what if she's going to do something, she's going to embrace it. She came back 6 months later, and my staff did not recognize her. She walked in, she was playing basketball. Our second visit after that was our goodbye visit because she's completely better. I don't think it would have worked as well had we not set the table with all the previous work we had done, but this was really dramatic, and it stopped that cyclical amplification that was going on that was keeping her sick. Any way that you can calm sympathetic overactivation, loving kindness meditation. I really like a program called Heart Math, skinar massage, poetry therapy. This is the heart and soul of healing our patients. And we can look at all the biochemistry, but if we go back to that network of networks, if we don't look at the top part of that network, at the person as a whole, the person as part of a community, they're not going to get better. So this is a summary of of the various steps. There's more detail in your handouts. And last but not least, I just want to introduce a new society that we have started called the International Society of Environmentally Acquired Inflammation. It's a professional society. We are a nonprofit organization. We will have founding membership through 2018 if you want to become a founding member. Our website isn't up yet, but look for it soon. So thank you very much for your time.